if one day you looked in the mirror and believed your face was crawling with parasites? That's the nightmare Brandi Glanville says she's dealing with, and it has sparked a lot of discussion and confusion. Before I begin, I want to make it perfectly clear. I've never met or examined Brandi Glanville, and everything in this video comes from her own public statements, interviews, and news reports. Hello, I'm Dr. Barron, and I'm going to explain Brandi's symptoms, experiences, and how medicine, both traditional and functional, could interpret what happened. This is a very complex case, but by the end of this video, you will see how fillers, the immune system, mast cells, and even gut health may all connect to Brandi's story. First, let's go over the timeline of events. In summer 2023, the very first symptoms started. Brandi says that while filming Real Housewife Ultimate Girls Trip in Morocco, she began feeling something unusual in her face. She describes it as if something was scrolling or moving under her skin. In late 2023, her face began to swell, then strangely collapse inward. She noticed bubbling under the skin. Doctors at one point diagnosed stress-induced angioedema, which is swelling deep in the tissues. In early 2024, Brandi shared that she decided to dissolve her facial fillers with an enzyme called hyaluronidase. She hoped this would fix the problem, but instead her face became more hollow and gaunt afterwards. Throughout 2024, she reported worsening symptoms. She lost 5 teeth, developed tremors, fatigue, and brain fog, and even used a lymphatic drainage device to try to manage the swelling. In August 2025, she posted a TikTok revealing chemical burns after applying Nair hair removal cream to her face, saying she was trying to kill what she believed was a parasite. Now let's start breaking down what happened. This is a complex case, and I want you to understand that when you see a patient like this, it's not as simple as pointing to one cause. I've seen many patients with complicated, overlapping symptoms. Putting it together is not like a flat puzzle where you just match the edges. It's more like a 3D puzzle because we are looking into the past, trying to reconstruct what started the chain of events. Let's start with the explanation from the traditional medicine. The first step is an immune reaction to the fillers. Brandi had hyaluronic acid fillers. They're normally safe, but they're not identical to your body's natural hyaluronic acid. They're cross-linked gels and sometimes contain tiny impurities. Scientific studies have shown that COVID infection or even vaccination can trigger delayed reactions to fillers, sometimes months later. The immune system suddenly notices the filler and attacks it, causing swelling, nodules, and inflammation. That might have been the first spark that lit up her immune system. The second step is mast cell activation syndrome, or MCAS. Once the immune system is revved up, mast cells, which are the alarm cells of the immune system, can become overactive. They release histamine and other chemicals that can cause swelling, fatigue and brain fog, tremors and shaking, nerve irritation, which can feel like crawling under the skin, and other symptoms. When mast cells stay active, they release a signal called TGF-beta. That signal tells the body to build scar tissue. Over time, that scar tissue replaces the soft fat padding under the skin. So even when the swelling subsides, there is less cushioning and more stiffness, meaning the face can look more hollow, tight, and a little uneven. The third step was dissolving the fillers with hyaluronidase. Brandi was looking for relief. After months of swelling and strange sensation, she decided to have her fillers dissolved with hyaluronidase. Hyaluronidase is an enzyme that breaks down hyaluronic acid, but it has limits. It doesn't always remove every bit of filler. Small particles and impurities often stay behind. And here is the important point. These particles don't dissipate into the sky. Your body has to absorb them. Sometimes in the process of breaking them down, the immune system gets triggered even more. Hyaluronidase also dissolves your own natural hyaluronic acid, which provides volume and hydration. So losing this natural hyaluronic acid also leads to a hollow, gaunt appearance. This cycle of ongoing inflammation, fibrosis, and tissue loss is now sometimes referred to as post-hyaluronidase syndrome. Number 4. The oral pooling of saliva. Brandi also described saliva pooling in her mouth, something that may sound small, but it can be very distressing and socially limiting. Here is what could be going on. In mast cell activation syndrome, the tissues of the lips, cheek, and oral cavity can swell, making it harder to keep saliva contained. But there is another layer. When fillers are injected around the mouth, over time they can sometimes harden and trigger fibrosis, scar tissue formation. That scar tissue reduces flexibility and changes the way the lips and muscles move. I have personally seen a patient with this problem. She had fillers around the mouth, and as they hardened and caused fibrosis, she lost the natural ability to swallow saliva subconsciously. Normally, all of us are constantly swallowing tiny amounts of saliva without even thinking about it. It's an automatic reflex. But in my patient's case, the scarring around the mouth made her lips and oral muscles less functional, so she had to consciously swallow further back in her throat to clear the saliva. If she didn't, it would start to collect and lead to drooling. That helps explain what Brandi described. The combination of mast cell-driven swelling and filler-related scarring could easily disrupt the natural process we take for granted, that effortless, constant swallowing of saliva that keeps the mouth clear. Number 5 is tooth loss. Brandi revealed that she lost 5 teeth during this illness, and that is shocking. For most people, losing even 1 tooth without clear trauma or decay is unusual. So to lose 5 teeth suggests something much deeper happening in the body. One explanation is chronic inflammation in the gums and oral tissues. In mast cell activation syndrome, constant swelling can erode the bones and ligaments that anchor the teeth. Another key factor is changes in saliva. Saliva is not just water, it's a protective fluid rich in enzymes, minerals, and buffers that constantly bathe the teeth. It neutralizes acids, delivers nutrients to the enamel, and keeps the mouth at the right pH. When inflammation disrupts this system, saliva can become more acidic, less mineralized, and less protective, which accelerates decay and weakens enamel. And finally, ongoing inflammation can interfere with the body's ability to absorb and use minerals like calcium, vitamin D, and magnesium. Without these nutrients being consistently delivered into bone and enamel, the teeth lose the steady reinforcement they need. So the tooth loss Brandi described wasn't random. It was likely the result of oral inflammation, saliva disruption, and impaired nutrient use, a combination that makes dental breakdown far more likely. Now let's look at it from the functional medicine perspective. Functional medicine analyzes things differently. It sees the gut as the foundation of immune health. Brandi mentioned she ate spoiled food before her symptoms started. A functional medicine doctor would see that as the start of leaky gut, where the intestinal lining become more permeable and lets food particles, toxins, and bacteria into the bloodstream. This overstimulates the immune system and can trigger or worsen mast cell activation. Now let's go over the tests and treatments of traditional medicine and functional medicine. When I evaluate someone with symptoms like Brandi's, one of the first things I would consider is mast cell activation. The challenge is that it is a very difficult diagnosis to make. Mast cells release their chemicals in bursts, so if you test between flares, the results may appear normal. That means the blood or urine samples really need to be drawn during an acute flare, when the patient is actually experiencing swelling, flushing, or other symptoms. The main markers we look for are serum tryptase, urinary N-methylhistamine, urinary prostaglandin D2 metabolites, and urinary leukotriene E4. If those are elevated during a flare, it supports the diagnosis of mast cell activation syndrome or MCAS. But I wouldn't stop there. With unexplained inflammation, I would also test for Sjogren's disease, including early Sjogren's antibodies, because this autoimmune disease targets the salivary gland and can change saliva flow and quality, which might explain both her oral pooling and loss of teeth. Treatment in traditional medicine is aimed at calming mast cells and blocking the chemicals they release. We can use H1 antihistamines like Zyrtec or Claritin, H2 antihistamines like Pepcid or Tagamet, leukotriene blockers like montelukast, and mast cell stabilizers like cromolyn or ketotifen. All these work through different pathways, but the overall goal is the same: to quiet mast cells and reduce the flow of inflammatory mediators that affect the skin, the gut, the nerves, and connective tissue all at once. Now, functional medicine looks at this through a different lens. Instead of just blocking mast cells, it asks, why is the immune system so overactive in the first place? And very often, the focus comes back to the gut. So what kind of tests would we order? We would want to check the microbiome, basically the bacteria that are living in the gut and whether they're in balance. I might also look at zonulin, which is a marker for leaky gut, and other stool markers that can show if there is a hidden inflammation going on. So the treatment steps for functional medicine is number 1, healing the gut lining. With L-glutamine and butyrate, these are nutrients that help repair the intestinal barrier. Probiotics and prebiotics restore healthy gut bacteria, and anti-inflammatory diet helps remove food triggers that worsen the cycle. Number 2, calming the mast cells and histamine naturally. Quercetin is a plant compound that stabilizes mast cells, making them less likely to release histamine. Also, DAO, which is diamine oxidase, is an enzyme that breaks down histamine in the gut, lowering the overall histamine load. Number 3, we'll try to regulate the immune system. We might use low-dose naltrexone or LDN, which helps regulate a dysregulated immune system in 2 simple ways. It briefly blocks opioid receptors, so your body rebounds by making more of its own endorphins. And those natural endorphins signal immune cells to calm down. It also gently quiets the immune system's danger sensors, especially Toll-like receptor 4, so they send fewer inflammatory alarms. And finally, number 4, I would support tissue repair and skin health. For example, proline injections in the arm, not the face. Think of it as giving your body extra building blocks. A tiny shot in the upper arm delivers proline into the bloodstream, so it's used everywhere, not just at one spot. It's not a filler, it's an amino acid your body uses to make collagen, which can support overall skin and connective tissue repair. We might also use topical NAD+ cream. This is like an energy boost for skin cells. When cells have more NAD+, they repair better and turn over more smoothly, which leads to healthier skin. We can also use GHKCU peptide cream. It is a small copper peptide that tells the skin to make more collagen and elastin. It helps wounds heal and can soften scar tissue. Over time, that can mean firmer, healthier looking skin. So here is the big picture. This case is complex, but there are real options. We can calm mast cells, rebalance the immune system, optimize nutrition, and support skin repair and collagen rebuilding. It's a gradual process, step by step. With time and consistency, things would move in the right direction. Now, I would love your input. Which public figure health story should we explore next? Someone in the news who's openly shared their experience. If you have someone in mind, then please post your suggestions in the comments. Who should we analyze next? Thank you for joining me. Please leave a like and subscribe. And remember, this is not medical advice and for educational purposes only. See you in the next one.